Hi, I'm Dr. Craig Chappell with Gulfcoast Ultrasound with your hot tip of the day. Today we're going to hydrodissect / block the ulnar nerve just distal to the cubital tunnel. If we go to the cubital tunnel, or just proximal to the cubital tunnel, I like to span the gap between the lateral epicondyle and the olecranon. There we go. So there's the ulnar nerve. And you see that the fascicles are a little bit swollen there, but like everybody's talked about, the ulnar nerve is oftentimes swollen there. However, there's a couple fascicles that are extremely swollen. So if we follow that distally, right through here is where that swelling starts. So you can actually see a pretty swollen fascicle right there. And so with nerve injuries, like carpal tunnel syndrome, the nerve will swell proximal to the constriction or the restriction. So I'm not certain that the problem is up here. So even though I see a kind of an enlarged fascicles, I'm not certain the problem's there, but if I slide down, I see that hypoechoic fascicle, and I keep sliding down the nerve. It's just below the arrow, and they look normal at that level. I believe that there it gets swollen again, that at this level, just basically distal to the cubital tunnel or that Osborne's ligament or fascia, that it got injured or laid on. So we're going to inject this spot and see if we can get that to feel better. I'm going to change the probe direction right now because I want my probe coming in just for my purposes. I want the needle coming in from the right side. And there's a little artery that travels by it. I'm just making sure it's kind of the bottom right hand of it. I'm just making sure that doesn't interfere with our injection or the plane we're going to be in. So here's the artery right here. If we go distally, we see that it leaves that plane of the flexor carpi ulnaris. I'm going to come in the flexor carpi ulnaris plane above the artery. So that's it. I'm going to come above it right here. The needle should come in right on top of it. So the artery's right here, right on top of that plane, and we should be able to dissect it out through here. The needle might actually come through the flexor carpi ulnaris right there, so we can get high and low on it. So when you're doing these, really anchor your probe really well so it doesn't slide around what you got going. I don't go back to my spot, my injection spot again. I don't touch that ever again. And we should see the needle coming from the right to the left around that nerve. So bevel down, inject right here, pop through that fascial plane. There it goes. So now we're going to come up a little bit more towards the right side of the screen. So we're going to go bevel down, back, up through. There it goes. One more time. We're not quite there. It's like stubborn. Right there in that area. We can get right on the corner. Doing okay? Nothing down your arm? There we go. Got it. So I'm having a hard time getting the top edge. There it goes. The top edge, I was having a hard time getting it to go off. You okay? Now we got the bottom edge too. So that last fascial plane just below that flexi carpi ulnaris was a little bit tricky to get through, but now we're good. Good. And now we're going to scan it. So we got fluid all the way down to here. So we got fluid all the way down to the mid forearm. We come up, we got it surrounding it all the way back up through the, actually into the cubital tunnel there. And around, and it doesn't get up that high. So it gets right basically as the flexor carpi ulnaris hooks onto the medial epicondyle and olecranon. So that's our hot tip of the day. Now it's your turn.